Good evening. Welcome to the first of a series of webinars around dry eye as part of Dry Eye January. My name's Nick Atkins from the Dry Eye Zone, the company behind the initiative for Dry January, or Dry Eye January. And I'm here with Dermot Keogh, who's a dry eye specialist and optometrist. And before we get started, I just want to share some welcome slides with you. Tonight, we're going to be talking about dry eye being a disease, and that's an important point to bear in mind. It is now classified as a disease. But I think a lot of people put up with dry eye and think it's just something they have to put up with. And we're going to talk about why that's not necessarily the case. Now, this is the first of 4 webinars, and there's a QR code here. So if you're not already aware or haven't already signed up, we've got some follow-up webinars over the coming weeks. Next week, we've got Professor James Wolfson from Aston University, who's a global expert on dry eye, and he's going to be talking about why eyes are dry, why do your eyes feel dry, gritty, or watery. And then the following week, we have a webinar from, in fact, the dates on this are wrong. Next week, we also have the cosmetic screen time and lifestyle presentation from an American optometrist, Dr. Diane Hilal-Campo. Now, Dr. Campo's passion project was to create a range of cosmetics that were safe to use and wouldn't sensitize dry eyes. So that's going to be a particularly interesting one. And finally, on the 29th of January, Thursday, we have From Drops to Devices with UK optometrist Nicola Alexander-Cross. Now, Nicola is the founder of Peak Club, a company that's developed a range of eye-safe cosmetics and also the heated eye wands that some people might have come across, which is a treatment device that uses heat and massage as well as LED lights to add aesthetic benefits. And she's going to talk more generically about the various treatment options that are available. Now, and finally, just wanted to make you aware, we're running a competition. Again, scan the QR code, and it's all via our Instagram. You can win a dry eye reset pack, which contains one of the said heated eye wands for meibomian gland support, some drops, some lid cleaners, eye gels, and dry eye friendly makeup that I referred to as well. All you have to do is scan the QR code and follow Dry Zone on UK on Instagram, comment on a last post about the worst thing about having dry eye in your experience, and then tag a friend who needs this. So I'm going to now come back to Dermot. And Dermot, one of the things I think I've touched on is that some people think that dry eye is just something you have to put up with. Why do you think there's this belief out there there's not a lot you can do about dry eye?
Thanks, Nick, for asking me to speak tonight. Well, I mean, really, a lot of people have this feeling because partly they may have, it's because it's a slowly progressive disease. They've started taking some eye drops. The eye drops may have worked, they may not have worked. So they've just tried something, and sometimes they can just give up. So people often just give up quite easily. And then they think, I just have to live with it. I have to put up with it. But you really don't have to put up with it. There are lots of ways we can help and manage dry eye symptoms today.
One of the things, if anyone out there wants to stick some of the things you're suffering with in the chat box, then feel free. It'd be interesting to know what kind of symptoms you have, what sort of dryness, or are you getting burning, watering? I mean, those are some of the symptoms. What other sort of symptoms do you come across, Dermot, that people complain of?
Well, a lot of the symptoms, are just as you've said, are the dryness, watery, irritable, gritty. They wake up with the eye feeling painful in the morning. They're sensitive to light. Lots of these various ones. Or they get worse in the evening. Their vision goes in and out of focus, a little bit blurry. And another patients often just say they're much more aware of their eyes than they ever were. And then they find that a little bit intolerable and gets them down.
Yeah, exactly. So could you just explain in very simple terms what dry eye is really? What's going on?
To understand what dry eye is, I think we just need to think simply. So think of the lens of a camera and it's got a coating on it. Well, our cornea, the coating of our cornea, the front surface of our eye is our tear layer. What simply happens is this tear layer breaks up and we have less of the ingredients that we need in the tears. So less of the oiliness and the aqueous. It's got three layers, a lipid, an aqueous, and a mucin layer. And it's missing some of those. And obviously we'll go on. I'm sure you'll ask me about some of the other causes, but when you're missing those, you then result in those symptoms.
I think the other thing that's important is that the tear film is so thin. I mean, about a tenth of a human thickness of a human hair.
Yeah.
So whilst we're talking about all these layers, and it's predominantly water, isn't it?
Yes.
Is most of it. We are talking about a very, very thin film. So what actually happens to that film that can potentially cause dry eye symptoms?
What happens to the film just breaks up, and that causes the eye to give the symptom. A bit like, the windscreen wipers will cause a noise and an irritation on the window. If you don't have a smooth, uniform tear layer, you get those symptoms. So that tear layer loses. And it loses because there's not enough oils. The majority of causes of dry eye is evaporative, meaning there's not enough oils coming onto the surface of the eye to allow it to be comfortable and clear vision.
And what are the things, I mean, it's a good analogy, isn't it? The eyelids are like the windscreen wipers of the ocular surface, aren't they? And one of the other complicating factors is if they don't fully close.
Correct.
What other aspects of causes problems to the tear film, and particularly thinking of that oily layer and the evaporative problems?
Well, in this area of our eyes, the upper and lower area, we've got little glands, and they have oils. And what happens is, for several reasons, those oils get a little bit clogged. And that means the oils then cannot come out onto the surface. So when you blink, lack of blinking and a poor quality blink is one of the major factors in dry eye. So when the lid goes down, you want to bring the oils back up and lubricate that area. And that's the majority of the problem is evaporative, where patients just simply do not have enough oil.
And I guess modern lifestyles, looking at screens, etc.
Yeah, lots of reasons. Incomplete blinking, as we said, lifestyle, screens, poor sleep, diet, general health, medications, rheumatoid arthritis, systemic health, autoimmune disorders. Several reasons, are the causes of dry eye.
And I guess a lot of people, it starts fairly minor. And that's probably part of the problem because we think it's a minor irritant and we might use eye drops. But it's a progressive condition, isn't it? What happens if we don't really take it seriously? What's
it's like it's like an analogy. You don't look after your car, you don't service it, things go wrong. What happens is after a while, with the front surface of your eye, you try the eye drops a few times, it helps, and then after a while it stops helping. But then what's going on is your eye becomes inflamed, and it becomes red and inflamed and sore. Then what you've got yourself is a problem then, because now that it's inflamed, it's very hard to dampen down that inflammation sometimes just with an eye drop if it gets to a certain stage, assuming the problem is that inflammatory. Because as we said, there are many other reasons. The surface of the eye or poor lids that may be the reason, but that is the problem. It gets to a stage where it becomes harder to manage and treat. It's perfectly easy to manage it, but it becomes a little bit harder. And that means the time taken to get it back to how it felt before will take quite a lot longer.
That all sounds a bit depressing.
No, I think,
Could we give some people some hope that there are things we can do for them?
And I think you're right. And it's not, it is a chronic condition, yes, but there is absolutely hope. There's no reason for anyone out there who's suffering badly with dry eye, they have to put up with it. We just need to get to the root of the cause, clearly diagnose it, and with the combination of treatments, your eyes will become, and you can be comfortable.
So coming back to the cause, why do some people get dry eye, and what you touched on, obviously, medical conditions can cause it, but assuming you're perfectly healthy, what else is influencing dry eye
Well, as I said,
symptoms?
it can be just, as we said, the evaporation, not enough oils coming on, poor water supply, the aqueous layer, there's not enough water there as well, not blinking well enough, or problems with your lids or lashes. You can get red lids, which there's people will have heard of the term, things like blepharitis, where the eyelids get red and irritable and sore. And they can cause, again, this inflammation in this area, which can be one of the primary causes of the irritation for the patient.
And other things that can trigger it at any point in time.
Oh, yes. I mean, it can be triggered if you had some surgery or ocular surgery. That can trigger it. Laser surgery can be one of the triggers. Contact lens wear over a period of time can cause the problem as well.
Is there a sort of typical dry eye sufferer out there? I mean, it seems we've always thought of it as an age-related condition. We were talking before we started about women generally
Yeah.
slightly more than men. Although as a dry eye
Yeah.
sufferer myself, I can say it's not just
Yeah.
a predominantly female condition.
I think with the increase in screen time, Nick, we're seeing more and more. We're beginning to screen our patients more and more, and what we're noticing is the amount of time we're spending on a screen. And what happens there is we're not blinking enough, and this is causing our oils, some of the oils, to stop, the oily glands to actually what we call drop out and not work at all. So before, you are correct in say, as we get older, the older patient, females, perimenopause, menopause, they sat in a large audience of our patients. But now we're seeing a significant group of, I would have said, kind of a younger group of patients we're noticing coming with these symptoms. And when we assess them, we're noticing their glands simply aren't as healthy as they should be for such a young patient.
We talk about the oily glands. These are the meibomian glands.
Correct,
and
yes.
It's often referred to as meibomian gland dysfunction. Do you just
Correct.
want to talk a little bit about that?
So meibomian gland dysfunction is simply where the oils are along here. Think of them, you've got tubes here. Think of those tubes like escalators. And we want the oils to keep coming up to the top of the escalator, which is the base of the lid, and at the top also. And when you go down, you bring the oils up. Some of those escalators get clogged because the oil in there, which we call meibum, becomes too thick. And some of the escalators stop working altogether. When the meibum gets thick, that's why for patients listening that will have heard about using warmth and heat, we know if we can get that oil softer and then massage the area afterwards, then that can get the oils to come out, and then that can help quite a lot. It does take it.
Yeah, and I'm sure a lot of the people listening are using heat in some way, shape, or form,
Correct.
And cleansers to try and clean the eyelids.
The lid wipes are very good as well.
And lid wipes, exactly. Yeah. And I guess one of the key things is that, do you find patients tend to, if their eyes start to feel better, relax the treatment? Whereas actually it's one of those things, as you say, it's a chronic condition.
Yeah.
I fully agree with you. Treatment, even if the eyes start to feel better.
Correct. You've just got to, like keeping fit and healthy with what you eat, you've got to do the same with your eyes. It's a long condition, but if you keep into a routine, putting the drops in during the day, not just drops, keeping the heat pad up. Some people are lacking the oil, so depending on what their diagnosis has been, if they want to take an omega-3 supplement or various things. My point is, whatever you've been advised to do, you sometimes have to keep it up, and then it becomes quite normal. And then you may find, yes, you have to do it a little bit less, but for the first minimum, when you get the diagnosis, you've got to keep things up for 6-12 months at least and keep it going.
Yeah. We've got some questions coming in, which is great, and I'll come on to those in a moment. But if anyone's got any questions, feel free just to tap them in, and we'll try and deal with as many as we can in the limited time that we have. I guess we ought to come on to diagnosis, because the key thing here with dry, once you've self-diagnosed, pulled some drops off the shelf, which may or may not work, and I think that's the other thing that that the drops didn't work. And trying to find a drop that works is a bit of a lottery, even for us as clinicians. Sometimes you recommend a drop, prescribe a drop, if you will, and it doesn't work for the patient, but it's getting the drop that kind of works best for their type of dry eye.
Yes.
But once that's kind of failed, because that's probably most people's first line of defense,
yes,
it's getting a diagnosis. How's the best way to go about getting a diagnosis?
To get a diagnosis. Yeah, go on, Nick, sorry.
The GP?
Yeah, well, I think the key is if the GP has the appropriate equipment and the appropriate experience, and then he is the person. But you'll probably find the majority of GPs will not be equipped with the sophisticated equipment that are available today, technology and all of that. So I think they're very much happy to pass the baton across there. You'll probably find a fair proportion of optometrists will at least be able to assess and diagnose. And then, like everything, there's always somebody who takes something a little bit more passionate, and there'll be then someone who spends more time and a clinician that digs deeper into whatever their speciality they enjoy. But to diagnose dry eye, you simply definitely need to go to a healthcare professional, an optometrist, to diagnose it. And they will diagnose it by taking a really good history and symptoms, and then using some of the equipment in the room to allow them to assess certain attributes to your tear quality.
Well, you're sat in front of a piece of kit,
I am.
The slit lamp,
yeah.
which is one of the core. I mean, every practice has a slit lamp, and that's largely
Absolutely.
what isn't available to most GPs. There are exceptions to that rule.
Yeah. So we very much use that along with some camera technology, which is attached to it, allows us to look at, first of all, the whole eye, because we went back and talked about the many causes, which can be the lids, the lashes, lots of various reasons. It's not just that. But once we then decide what are the various causes, we then, in the tear layer, it can simply be when we use our microscopes, we're watching how quickly the tear breaks up. We use some little dyes that we put onto the eye that helps us to see, is there any particular areas on the surface of the eye that are problem areas, or is there particular areas on the eye that are drying out, as in the tear layer is disappearing quicker than we'd expect. So absolutely, you need a really detailed history and symptoms and an understanding of the lifestyle of the patient, and then a detailed examination using appropriate equipment.
Now, all optometrists have a basic understanding of dry eye, but do all eye care practitioners? You've specialised in it. I mean, there are an increasing number of optometrists who specialise. But what are your thoughts on seeking out an appropriately experienced, if you like, optometrist?
Yeah. I think sometimes
or optician, for that matter.
Yeah, sometimes. Well, one, you can go on word of mouth. Two, if you're happy with your optometrist, you could at least ask them and say, "Is this an area you like to specialize in?" And if it is, then you can proceed with them. But if it's not, many colleagues will refer to each other for their particular speciality. So they will be very happy to refer you to a colleague with a greater speciality in dry eye.
And one of the things I think is probably worth just touching on before we get into the questions is that, unfortunately, this isn't funded by the NHS.
No.
I mean, some patients might be referred in certain areas where there are schemes like the Minor Eye Condition Scheme, the MEC scheme, and it turns out they have dry eye, and that initial assessment will be potentially funded in that practice by the NHS. But ultimately, once it comes on to more advanced diagnostics, for example, and of course any treatment, that is going to be a private appointment rather than an NHS appointment.
Yes, it is. Yeah. Unfortunately, it is a bit like that. And in dentistry and various other options, that these appointments now have the funding isn't been made available via the NHS, so the patient will have to pay privately for these appointments. The hospital, I'm sure, will happily see them. But for long-term treatment and management, then you're right, it is unfortunately not an even playing field.
No, absolutely. Right, let's get to some questions. Nicola has asked, is heat the best remedy to help dry eyes?
Thanks, Nicola. Well, it depends if your problem is evaporative, Nicola. If the oily glands, as we pointed out, if those glands are blocked, and then heat will absolutely help for you. But it's understanding clearly if they're blocked. One little thing I tend to do is I like to squeeze the patient's glands. They don't like it, but I do it. And that allows me to see the quality of the oil. If it comes out a bit like toothpaste, Nicola, the heat's right for you. But in most cases, it is heat does help, but I can't say 100%.
Yeah, and I think that's an important point we do need to make is obviously what we can't do here is give you any
No.
clinical advice on an individual basis. You need to speak to your eye care practitioner
Yeah.
for that, but we can give you a general feel for the subject before you seek greater advice. Interesting question here, because I was in a practice today where this came up as well, a patient using a CPAP for sleep apnea. And does that promote dry eyes using?
I think you'll generally find patients, in my experience, patients who have sleep apnea have dry eye. As I touched, I think, on one of the causes earlier, Nick, I said poor quality sleep is a reason for it. But then it can be how the device is fitted, and if it's incorrectly fitted, that can make quite a difference. So my first port of call would be ensuring the device has been fitted correctly.
Yeah, and that's absolutely. And one of the things we mentioned to this particular patient today, who was lying on his side and I think also slightly loose lids and probably had partially open eyes, is the use of ointments at night.
Yeah.
I use them because I know I sleep with my eyes partially open, and if I don't, my eyes are quite sore in the mornings. So that's one way of dealing with that. This is an anonymous question. I've been told I've lost 25% of my meibomian glands. This is a very good question. Is there anything you could recommend?
Well, good news, you've got 75% left. So let's take the positives out tonight. And yes, there is. You can reinvigorate, manage the 75%, keep them working, and that'll keep your eye nicely lubricated. There is limited evidence to show that using certain more sophisticated technology called intense pulse light can reinvigorate the lost ones. But that evidence is a little bit weak at present. But definitely be happy with your 75%. And if you can get those oils moving, get them unblocked, getting them out there, you'll be okay.
Yeah, and I think it's, for us as professionals, always better to get the natural oil going than trying to use. There are drops out there that use artificial oil. And the jury's out as to how effective they are.
And there's scans there now. We can clearly see how many are blocked when we look at them, and the patient can look at them as well. So that's really helpful for the patient.
Yeah, absolutely. This is a good question as well, anonymous. What can we do to protect our eyes if we work on screens? Because as this person points out, he or she can't stop this work. They've got to carry on. What tips
it's a very
do we
good
have
question.
there?
I think what we may not realize is we are blinking a significant amount less. So one of my key pieces of advice to most of my patients, whether they present for dry eye or not, is improve your blink rate. And not just blink, do a complete blink, complete that blink, and find an association that helps you blink. If you're reaching for a little glass of water, say, oh, I'm going to take a little blink now. So find little associations. I think you'll probably find the more you improve your blinking, the more you'll find your eyes will become more comfortable. That's one of the main reasons that will do it.
Okay. There are so many questions coming in. I'm going to have to apologise to people. We're not going to get to them all, and some of them are really brilliant. And I wish we could cover them all. So let's just go to what is the treatment for dry, itchy eyelids?
Dry and itchy eyelids. Well, again,
depends on the cause.
It does, depends on the cause. Sometimes it can be lid wipes can help with itchy eyelids. Sometimes they can help. Sometimes it can be allergy related. It can be contact lens related. And sometimes you may need to dive into some medical management to help with the itchiness of the eyelids. I think removing any what you think may be pointers or causes, if you think there's an allergy around the house or something that may be causing it, I think that's what I'd like to do first. And again, going back to our history and symptoms, Nick, if you can dig deep into understanding everything about the patient, you might find we can find the answer to what's causing the allergy.
Yeah, that's a good answer. And one of the things we haven't really talked about is Demodex blepharitis, of course, which is quite prevalent. We now know probably affects 50% of people. It's more prevalent as we get older than we're younger, correct, but there are youngsters presenting with this at the moment. And that may well come up in another webinar, probably with James Wilson's one next week. So we won't touch on that, but there are treatments. And someone has asked about lid wipes. There are plenty of eyelid wipes on the market. We have some on the dry eye zone that we've selected that we think are particularly good. But again, the best advice, depending what you're trying to do with the lid wipes, there are different lid wipes for different types of dry eye, isn't there? And that kind of, I mentioned youngsters before because there's a question here. My 20-year-old son has almost permanently red eyes. Could this be dry eye?
Yes, it could well be. Again, I'm going to go back to what I said earlier, probably screen time. Don't want to get him in trouble, son. Sorry about that. But it could simply be staring at a screen for long periods of time. We find a couple of young kids who are gamers have a lot of problems with dry eye because they're staring for 4, 5, 6 hours at a time. But again, I would get it checked, go to your optometrist, and at least they should be able to help with an answer, just in case it's anything more serious that we could easily help with also.
I think the important thing for people to understand is that the blink rate when we're staring at a screen, and driving is another condition which some people start to notice. If you've got the air blowing up over your eyes and you're staring, particularly at night when you tend to concentrate even harder on the road ahead, your blink rate's gone down by about 2/3. You're blinking at, a third of the rate you would normally be blinking at. And that's exposing the ocular surface, and that's causing the tear film to break up and the eyes to feel dry. And it's the same with screens. And one of the things that is worth also is the 20-20-20 rule, isn't it, Dermot? Do you want to explain?
Yeah, absolutely. Taking a break every 20 minutes and looking at something 20 feet away. And again, that's nearly what I was trying to say with the association with the glass of water. If they can't remember the 20-20 rule, just, taking a break and looking at something, for 20 feet for 20 seconds, that's great. But if that doesn't work, just simply try an associative task. I find that works very well. Or even if you're using the enter button on your screen, think, oh, he mentioned the enter button. I need to remember to blink. Or I have a glass of water, just something little that you do every so often, that you think you're doing quite a lot, then bring that into your day and then use that as a pointer to help you blink more.
This is a good question from Alan. After using a heat mask, and this is something I think a lot of people will find useful, how do you massage the glands?
That's a great question. First of all, it's not easy. Is the quick answer there. I think there's several ways. You can just, you could use a cotton bud to help roll up along there if you wanted to do that, or just use your fingers to just go along, rub in a circular fashion all the way along. And the same with your upper lid, rub in a circular fashion along that way. It is not easy. And that meibum can get quite thick, I'll be very honest. But the more you use, and again, depending what your cause is, the more you use the heat, then it will get softer, and then you will hopefully get the oil out, and you may have the symptom of anything, your eye getting a bit blurry, because that's the oil coming onto the surface of your eye.
There's a few questions around heat, which I'll try and combine. Sue asks around, she was concerned about heating up the fluids inside the eyeball. They expand and lead to glaucoma. Could you comment? But similarly, can heat make dry eyes worse?
Sorry, Nick, I lost your connection for a second on that.
Sorry, I had
Yeah.
an alert pop in. Can heat make dry eyes worse?
Again, we don't know what the cause is. It's unlikely to make it worse.
The one thing that has been suggested is starting to pop up is it's an inflammatory condition, as we know, and
Correct.
heat, and you don't normally use heat, and there are some. I can think of a renowned American practitioner who's now saying you should use cold rather than heat.
Yeah.
I don't particularly subscribe to that point of view, but I think in some cases, if you have raging inflammation, then maybe heat isn't a good thing, which comes back to diagnosis.
Correct. I mean, look, to be quite honest, we still know using certain types of heat for certain durations can reduce the oil, reduce the thickness of the oil. But also there's newer technologies called low-level light, red light therapy, etc. Now that goes directly at reducing the inflammation in the area. So without getting too technical, there are other treatments. Yes, you're right. Heat will suit some and not others. I accept that. And you're right that sometimes cold. I know who you're talking about in America, a good friend of mine and colleague who you're speaking about. And I have read, but he does also discuss the heat quite a bit as well.
Someone says, thank you, Dermot. That might be one of your patients. I don't know. There's a number here. Are meibomian glands in both the upper and lower lids? I'll answer that. That is absolutely the case.
Yeah.
And it's important, actually, that your practitioner looks at both sets of eyelids. It's very common to look at the lower eyelids, but we're now very aware that the upper eyelids play as much, if not more important, a role. And if we don't look at those, and they can look very different, you can have plenty of glands in the lower lid and not so many in the upper lid, and vice versa. So you need to, the practitioner needs to look at both eyelids. Will heat help if you have punctal plugs in situ? For those who aren't aware, punctal plugs are the little silicone plugs that go into the tear duct. And that's a treatment that can be very beneficial for holding more of your natural tears on the surface of the eye again, hopefully reducing the need for artificial tears. But heat's not a problem with punctal plugs?
No, no, not a problem at all. And normally if you've got punctal plugs, you've got quite a chronic dry eye. And I think that's where you could even ask your dry eye specialist, is there anything else? I generally find there's other things one can do in addition to punctal plugs today, be it medication or the more sophisticated treatments, without doubt should be considered in a patient that's now using punctal plugs.
I think there's so many more questions and we're just not going to get to them. I will come to this one because I have a vested interest. Patients allergic to lanolin, is there a nighttime gel you can recommend? Because most contain lanolin. We sell on the dry eye zone Hydromed Night Sensitive, which is the only, to my knowledge, a lanolin-free gel. You use that in practice?
We do, yes.
Yeah. So again, the question around how to identify an optometrist or ophthalmologist who specialises in dry eye. Any quick thoughts?
Google, it sounds Dr. Google, go into your area and type in dry eye specialist, dry eye clinic. I think that's a really good way. Most clinicians who are advanced in treating dry eye will have a separate little section on their notes on their website for that. And that's probably where you'll find them first. That would be my recommendation. Or ask someone who may know, but definitely go online. You may find that's where you'll find your dry eye specialist.
And a couple of final questions. This one's quite a good one because I think it just shows that you don't have to spend loads of money and use lots of products, although this is a product. Humidifiers, would this help with dry eyes? My view is yes.
Yeah, it does. It can improves the environment in your room, but also dehumidifiers can, as I said, dry eye has many causes, and you may find there's other things going on in your house, be it mold or dryness or things in the house that dehumidifier will help reduce, and then that in turn will help with your dry eye.
And this patient's clearly come across radio frequency treatment for the eyelid glands. Is it worthwhile?
So does radio frequency work?
Oh, have you frozen?
Yeah, so did you. Sorry, I think we both froze at the same time.
That's all right. Yes, I think we both froze.
Yeah, radiofrequency, again, there's not a huge amount of evidence behind it, but you may find with certain patients it works. And again, without going back again, getting the clear understanding in the diagnosis, and if they were diagnosed with a type of dry eye which the clinician felt the radiofrequency would work, then quite possibly it's not something that I'm overly familiar with, and not something that's regularly used at the moment, as far as I'm aware.
Okay. I am going to close the questions there. As I say, apologies to everyone if we didn't manage to get to your questions. Hopefully, you've got some benefit from the excellent advice that Dermot's been providing tonight. As I say, there's 3 more webinars coming up during the month of January where we focus on dry eye. The Dry Eye Zone is a resource that you can use for education. There's loads of blogs on the Dry Eye Zone. It's designed to be a website to educate and inform, as much as having a shop of products that we've selected that we think are particularly effective for dry eye. I think the key thing is that you don't have to let it impact your life as much as perhaps it is at the moment. And there are products out there. It is a chronic condition. You will have to manage it probably for the rest of your life. And it's important to manage it, isn't it, Dermot? Because if you don't, then you risk it getting worse, which will be even more unpleasant. But it is a very complex issue that research is going on constantly, because we still don't fully understand dry eye. But we're making huge strides in the diagnosis and the management of it. And it isn't a problem that you have to put up with. So please seek advice, find a dry eye specialist, and hopefully you can start to get away from the discomfort and forget about your eyes for a while, because there is nothing worse than constantly feeling that your eyes are dry and sore. So thanks, Dermot.
Thank you for asking, Nick. It's been an absolute pleasure to be on tonight.
No, thank you for agreeing to do this. And this will be recorded, so if anyone, we will be posting it out afterwards on Instagram and LinkedIn, and to the people who have registered. So pass it on to people who need to know more. Thank you for your attendance, and we look forward to seeing you next week for our next patient webinar. Bye now.
Bye.